Dr. Pramod Bhor, Director of Orthopedics at Fortis Hospital Vashi. Today I'm going to speak on a topic. So, do untreated fractures have long-term side effects? Yes, whenever there is an untreated fracture, they will give you some side effect. So, what do you mean by an untreated fracture? So, once you understand any fracture is going to unite, it's a simple thing. It is not that the fracture will always go into non-union. So whenever there is a fracture, we treat it either by using a plaster or we treat it by doing a surgery. So what are we doing when we are doing a surgery, and when do we give a plaster for a patient? So undisplaced fractures, extra-articular fractures which are not in the joint, we give them plasters and we allow them to heal. There are basic guidelines how the fracture has to be positioned, what is an acceptable reduction and what is should not be accepted. So whenever we consider this and give a plaster or immobilize a fracture rather, it slowly and steadily heals. So average healing time of a fracture is from 1 to around 2 to 3 months depending upon the age of the patient. Younger patient it heals faster, and older patient it heals later. So other thing that can happen is, if you are giving a plaster, it will unite and it will unite well. Sometimes when it is an intra-articular fracture or it is a fracture in the joint, it is quite displaced. That time we have to operate and fix it with either a plate, screw or a nail depending upon the fracture site and the anatomy of the fracture. So once we are doing that, we are just holding the fracture from inside as we were holding the fracture from outside with the plaster. We are not healing the fracture. The fracture again will take a similar time to heal, say around 1 to 3 months depending upon the age of the patient. So what are the complications when we are not treating the fracture? An untreated fracture can result into two things. Either they go into non-union, wherein the fracture is not uniting, or they go into malunion. So if I mean by non-union that the fracture is not united, it remain painful, but there will be abnormal mobility at the fracture site and length or the stability of the limb is not maintained. So the patient is either not able to do any heavy work, the muscles around and the nerves around, they are not very useful, and the upper limb or the lower limb starts reducing in size. There is wasting of the muscles. So this is for non-union of when there is non-union. So in non-unions, majority of the patients will understand that there is non-union and they normally approach doctors, and then later on we have to do either a fixation by using, and along with plating and everything, we have to do extra procedure that is called as a bone grafting so that the fracture unites. This is one part when it goes into non-union. Now the other problem is malunion. So if we are not treating the fracture and they go into malunion, so whenever it goes into malunion, you see shortening of the limbs. So your legs remain short or your hand remains short, and it becomes more and more difficult to walk. So in case of lower limb, if there is shortening, it will cause pain in the spine because of the abnormal gait and everything. It remains painful also because the muscles do not act according to the anatomy. So because it is a malunion, there is shortening, there is bowing. So you see the legs there is some amount of deformity in the leg. Considering the deformity, it is going to remain more painful. When the fracture is intra-articular, that is through the joint, it will cause early osteoarthritis. The joint will become more and more painful with time. So even if you consider a fracture which is treated by plating or it is treated by anything, once the intra-articular fracture, that is, if it is treated, it will unite. It won't lead to arthritis early. So if a person is going to go for an arthritis at the age of 60, that is age-related process arthritis at the age of 60, if remains untreated at the age of 30, will have arthritis at the age of 40-45, whereas a treated fracture, a fixed fracture, will have arthritis at 58-59. So it is that way. If you treat intra-articular fracture, the arthritis will be delayed, it will not come early. But whereas an intra-articular fracture untreated has early arthritis, and it has got more and more pain. So pain is one problem, and this then further requires treatment in terms of replacement and any other procedures. So it is very important to understand that all the fractures, they have to be treated, whether the treatment is by surgery, whether it is by plasters, or whether it is by immobilization in terms of braces or belts. that is a secondary thing. But if they are left untreated, there are always chances of complications like non-union and malunion, which are more detrimental to the patient in the future. So thank you.